Brilliant. So, as I said, thank you ever so much, everyone, for joining this afternoon. My name's Andy McGowan. I'm the head of engagement at the charity Caring Together, and I'm really delighted that we're having this session this afternoon. I think seeing in terms of how the men's football team are performing at the moment, there's still that faint hope that it might be coming home, following on from the Lionesses' success over the summer. And we've seen also this morning in the cricket, in terms of actually records being broken by the England men's cricket team. So I think there's a real lot of focus around the sort of positivity around sport at the moment. So I'm really grateful for the opportunity to be able to share some of the brilliant work that's going on. How can we use sport to really help improve the health and well-being of young carers? So what we're going to have today is a series of different examples of some of the work going on across the country, from football, but also other sports as well from that sense. We'll also hear in terms of actually some of the background about why this work's so important in terms of some of the impact on sort of carers' access to staying active and leisure activities as well. So just in terms of a bit of housekeeping to get us started, if people can ensure their microphones are on mute at all times, that'd be much appreciated. Obviously, if you're wanting to speak, then just unmute yourselves. You've got the opportunity to do so. As I mentioned, for those who've just joined, we are recording this afternoon's webinar so we can make it available for people who are unable to join and to catch up at a later date as well. Please do introduce yourselves in the chat, make use of the chat. We've got a really good mix of people in the room. We've got people from young carers organisations, people who are linked to sort of football clubs and their community trusts from that sense. We've got those who are involved in sort of health and well-being, so a really diverse mix. So please do make the most of this networking opportunity. Because of the size of the group, we should be able to answer sort of questions either in the chat or if people want to put their hands up as we go along from that perspective. If there are any unanswered questions at the end, we will make sure we follow them up when we send the slides around as well. And finally, for those of you who are on Twitter, excuse me, please do join in the conversation. So we've got a Twitter account which is @YC Alliance. So you'll be glad to know that's me done for most of the speaking today, because I'm delighted to hand over to John Banks. So for those of you who don't know, John Banks has been a long-standing supporter and champion for young carers and support for young carers, formerly as a commissioner for many years, and now most recently as a policy advisor supporting sort of improved support for young carers. And John's been sort of spearheading a lot of this work around how we can use sport to improve the health and well-being of young carers and young adult carers. So without further ado, I'll hand over to John.
Thank you, Andy. You can hear me okay, yeah? It's thanks for the introduction. I'm afraid it's all going downhill now because you've got me, but I'll do my best. As Andy mentioned, I've worked in carers and young carers work for actually since the end of the last century, feeling my age now. I was the carers lead in a large local authority for 26 years, and I'm now styled myself as an independent carers policy advisor, which is probably a form of self-appointed busybody, but there you go. Anyway, one of the things I do, other than being involved in campaigning around carers and young carers, is I have a sad obsession for Kingstonian Football Club, and the shirt I'm wearing today is our club shirt. And I was interested to know whether there were other clubs doing stuff. I had heard of something about our neighbours from the much higher up the football pyramid, Brentford, doing stuff, and spoke to Andy about whether we might do an information trawl. We did this, found far more than we'd expected. Found information about 24 clubs. I suspect that there are other things going on. For example, we found last week that our colleagues from the Liverpool Young Carers Project have a community partnership with Everton City in the community. So if there is other stuff out there, please do let us know. Anyway, there's a link to the report, so if we could have the next slide, Andy, or whoever's pressing the button. We've got a range of speakers today. Unfortunately, Dom from the Rugby Union, sorry, from England Rugby, as they're now called, is unable to attend today. His partner's had an op, and it's turned out that she needs a bit more support than for a few days than they'd first thought. So I'm afraid you'll be stuck with me. But that's one of the examples of how this conversation's spilling out from football to potentially all over the place. So have the next slide, please. I mean, people on the call, I expect, will know this, but we know that research from the BBC suggests there are far more young carers in our country than the national census had said. Estimates range from about 800,000 actually to even as could be as high as 1 million young carers. We don't absolutely know, but what we do know is that where people have worked intensively with schools, they find far more young carers than are supposed to exist according to the census. And it really does mean that almost anywhere where a football club's got a youth section, they will have young carers in it, and also young carers who would just love to get involved if time and support enabled them. And in any large football crowd, there's going to be 10% plus of the crowd are carers, quite likely. So next slide. I mean, I think, again, this audience will know about the impact of caring. Young carers statistically are likely to have lower educational attainment than their peers. I mean, this isn't just about children ending up being in the NEET category and hardly getting. It can also be about a young person who would have been a straight A+ student ending up with C's and D's, and no one's going to notice that because it was okay. But again, there's loss of potential. Having time and space to just have fun and be a child for a while can make a huge difference to young people's lives. And we've found that football clubs and indeed other sports organisations can really help with this, as we'll show as we go on. Next slide, please. So people who've looked at the report will have spotted that I think basically all the Premiership and Football League clubs and quite a few actually even non-league clubs actually have community arm, which are typically independent charities, and it's mainly those with whom the work's been resting, then working in partnership with local young carers organisations, and in some cases with social care, in some cases with the NHS locally. We've got information about a couple of the Premiership clubs, and so I'll get onto that as we get to their slide. Next slide, please. So the first one, just want to touch on, if I might, is I'm hoping that Laura Cole from My Time Young Carers will be on the line. Are you there, Laura?
Yes, I am. Hi, John.
Hi. So thank you very much for joining in. This is an opportunity to listen to something more interesting than me droning on. So, Laura, could you tell us just something about how you started this work, or your organisation did?
Yeah, so last year was our first year of being a charity partner with AFC Bournemouth, and this is our second year of being a charity partner. And partly to do with being a charity partner, AFC Bournemouth Community Trust contacted us and said that they would want to do 12 sessions over the academic year with the young carers that we work with. And so we organised it with the 4 schools who are all closest to the stadium. And once a month, we have the young carers from the school come to the stadium, have a tour around the stadium, do some sort of like classroom-based activities around life goals, ambitions, healthy eating, and so safety. And then we spent another 45 minutes kind of doing physical activities, which included football, but also included team games and everything. And it was really incredible to see all of those young carers kind of grow in confidence and awareness of themselves over the 12 months. And yeah, it was really incredible to see.
So you're in your second year, and from what you were telling me when you were chatting, we were chatting the other day, you said in the first year you had young carers meeting, so if you like, more in the community, but now you've been taking a lot of this into schools, is that right?
Yeah, it is. So this year we've kind of working it slightly differently, and what's happening is the community trust team are going into schools once a term, 4 schools once a term, and then they're also bringing all of the young carers together at the stadium once a term as well. And the reason we did this was purely logistical, and it's just easier to kind of access the young carers when they are in school, rather than trying to get school to transport the children to the stadium as well. And it's just working out better for staffing and travel costs, really.
Yes, I imagine also actually having the activity in the school itself means there's a certain profile amongst the student population and indeed the staff of the school that might have been out of sight, out of mind if they'd gone off to somewhere else. Yeah,
absolutely. I mean, these are all schools that we work with in our Level Up programme, which is our staff training, school training programme. But what it does is it reminds all of the other staffing that we don't work with the young carers on a day-to-day basis, that these children are young carers, and that sometimes they miss out on other opportunities that these that other children get. For example, the children receive tickets to go see a football match as well, and a lot of them have never seen a live football match, considering we've got a Premiership League stadium right in our town as well. So it's an incredible opportunity for these children as well.
Thank you, Laura. So if you can, you'll obviously stay on the line and be listening, but also hopefully can join back in the conversation as we progress.
Of course.
So if I could have the next slide, please. So I noted in the report that we've seen a lot of, Andy mentioned the success of the England and men's and women's football teams, and they've had they've had a lot of success in raising social issues. I mean, Boris Johnson and his many successors, Conservative government, haven't had many defeats. They have had a few self-inflicted ones recently, perhaps. But 3 of the defeats they had inflicted on them were actually by Marcus Rashford and the England football team. I mean, the government were forced to rethink on feeding school kids, and also to be more proactive about opposing racism in football. They've also the football has also had quite a role in challenging homophobia. And we think there's a potential to do something similar for carers and carers more generally by raising awareness. I mean, the example, I mentioned mental health as well, and actually the national charity Mind and the English Football League had a really quite successful campaign 2 or 3 years ago, where there was some activity around mental health awareness in virtually all of the teams in the English Football League. So I think big potential there. Next slide, if I may. Right, carers active. Have we also got these slides from Patrick?
Yes, John, they follow straight after this slide.
Yeah, so well, can we skip this and I'll let him talk to that. So next slide.
Yep, that's fine. Patrick, did you want to share the screen and do it yourself, or would you like me to click through? I don't mind either way.
It's fine if you're able to, Andy, that's fine.
Yep.
Yeah, just save me sharing. Great, thank you. Do you want me to start, John?
Well, I'll just say, why have we got Carers UK and Carers Active in a young carers session? Well, firstly, Carers UK are part of the carers movement, and there's a lot of conversations going up and down the country about all age carer strategies where you have combined adults and children's, and so we need to have joined up conversations in the carers movement for one, but also Carers UK has this project Carers Active, and there just seemed to be a lot of synergy, so we got in touch with Patrick and one or two of his colleagues, and there seemed potential to work together. So Patrick, if you can tell us a wee bit about what you're doing and about maybe the Carers Active April campaign that we're looking to work on together.
Yeah, sure. Thanks, John. Yeah, hi everyone. Nice to be able to join today. And as John says, there's definite connection with the work that John and Andy and others have done around identifying sports clubs that support carers and how that connects with the Carers Active project, hopefully. So could I have the next slide, please, Andy? So just a little bit of background about some initial research we did in the lead up to the project starting. So through some funding from Sport England, we were able to look at some actual experiences and findings around carers and physical activity. So you can see a few stats on the screen there. So carers, unsurprisingly, are less likely to be active than the non-caring population. And then also stats. So although there's less activity done by carers, there's also carers want to be active. So 3/4 of carers do not feel that they're able to do as much physical activity as they would like. And that's due to some barriers, which I'll go on to explain now. Could I have the next slide, please? So as I mentioned, that stat around carers want to be active, but there's significant barriers due to caring that kind of stop that sometimes. So some of the main barriers that carers have fed back to us through the project is that not having the time to be physically active is a big one. Not always feeling motivated or having the energy. Not being able to afford the costs, and that's particularly relevant now as the cost of living increases even more, and not having anyone to go with as well, so that overcoming that first barrier of trying something. Another barrier that wasn't listed on this slide but came through was sort of understanding what physical activity means. So there's a lot of preconceptions about what being active means. So as part of the project, we've wanted to try and explain that you can be active in lots of different ways and in ways that work for you. It doesn't have to be 5-kilometer runs every day. So it's about finding an activity or activities that work for you as a carer. Next slide, please. So just a few more findings from that research that we did through the project. There's a kind of feelings of guilt as well is another significant barrier. So feeling guilty about being away from the person that they care for. Not having enough sufficient and quality replacement care, which is a wider issue in itself, but does have an impact on carers being able to be active. Some carers are only able to be active with the person they care for, or only want to be active with the person they care for. And also some carers have their own health conditions as well. Next, please. There's also quite a significant link to loneliness, something that the project is hoping to reduce. So just a couple more stats there around carers are more likely to be lonely than non-carers. And their lonely carers are even more inactive than those that say that they're not lonely. So there's a real need to try and support carers to reduce that sort of isolation and loneliness that carers of all ages feel. Next, please. So again, although the study showed that there are significant barriers and that carers are more inactive than non-carers, those that have taken part in some of the work we've done through the project have said that when they are regularly active, that their life satisfaction increases, they feel more happy, they have a reduction in stress and anxiety, just to name a few of the outcomes. Next, please. So the Carers Active project was set up through funding from Sport England, and is a 3-year project which began in June 2021, with the main aim really to increase physical activity levels of carers of all ages, decrease that loneliness that I mentioned, and increase carers' health and well-being as a result of being active. So the project takes a few different forms. There is some direct delivery with carers, whether that's online sessions or resources. We also want to share good practice amongst sort of deliverers or carers organisations, those that are coming into contact with carers. And today's a great example of that, with lots of sports clubs doing great work, raising awareness about some of those stats that I talked through, so carers being inactive, trying to bring organisations together to collectively support carers and learn from those outcomes. Next, please. So just a few things to touch on within the Carers Active projects. We have a Carers Active Hub, which is an online resource for carers to access and organisations that support carers. John mentioned it. We have a Carers Active April campaign month, which we ran for the first time in 2022, and we plan to run again in 2023. We deliver some online physical activity sessions, roughly 1 a month, and are working on some resources and sharing good practice with service deliverers. Next, please. So just on the Carers Active April campaign, last year we had 500 carers sign up to take part. There was a few different things that went on throughout the month. We had some online sessions. We had a starter pack which went out to any carers that signed up. We had a supporters area of our Carers Active Hub for any organisations that wanted to get behind and back the campaign. And we also had some media involvement to help spread the message. So we're really excited about running Carers Active at April again in 2023. That's all right, Andy. Next. So yeah, just a few things we've learned so far through the project is that there's lots of organisations already delivering really good work to support carers, as we heard the Bournemouth example there, which is great that there's so much going on already. Sort of making physical activities approachable for beginners and all ages of carers is really important. Sometimes having that option where the carer can be active with the person they care for is important, as is the flexibility of online or in-person activities. Making it as low cost or free as possible, having other carers involved, whether it's a volunteer or just as a participant. That's quite motivational for carers to take part with others that are in a similar position to them. And having an opportunity to socialise or feel part of something bigger was something that came through in the feedback from carers. Next, please. So just a few things I thought would be useful, particularly for today, just some things to think about with how we could connect with, football clubs, other sports clubs, is we have the Carers Active Hub, which has got lots of tips, advice, recordings of sessions that carers can do. We're just currently producing some video resources, which will feature young and adult carers. So there'll be video case studies, which I think could be really powerful when we're promoting to young carers, especially about being active. We have a newsletter which features updates, resources, best practice and links. We have our share and learn sessions. So as I mentioned, that's roughly 1 a month. We run them through Zoom, and they're open to any carer of any age to join. And then we'll have the Carers Active April campaign month. So we'll provide some resources and copy and social media graphics for organisations to get behind that month. So we would encourage organisations to try and to run some activities as well during April. So I'll be sharing more information with John and the network about that in due course. I think that's it really for me for now.
Great, thank you. Thanks, Patrick. So that I think you can see there's a lot of relevance and synergy there to be had. A lot of the issues for young carers are very similar. They're expressed somewhat differently according to age, of course, but as well as the chance to being physically active, being good for people's physical and emotional well-being, the opportunities to mix with other young people, whether it's with young carers or more generally with young people in their children in their area, is also really valuable in terms of reducing social isolation, and that also is important for the emotional well-being of young carers. So we could move on to the next slide.
John, just before we go on to the next slide, you've got a question, you got a hand come up where I'm guessing of a question, which we time-wise we're probably
okay, yeah.
Janet, did you want to come in there?
Hiya, yeah. Hi, John. As you know, I'm a family and carers governor of the Mental Health Trust, and in the mental health world, there's a movement called Sport in Mind. So you mentioned earlier, didn't you, about the campaigns with sports clubs and football clubs and everything, and looking at mental health people. I'm just wondering whether all of this wonderful, terrific stuff could piggyback onto what's already there. So making links with Sport in Mind to see how can use whatever they're doing and just expand it a little around carer stuff and young carers. That's my question anyway.
Yeah, well, I agree with the question. With the question, was sort of a statement really with which I agree. So the answer to your question is yes, absolutely. I mean, out of interest, my own club, Kingstonian, that I mentioned, and for a little no hope at amateur non-league team, it's getting a lot of mention today. But we have, as well as a community partnership with Kingston Carers Network, our other community partners are Mind in Kingston, and together we run three football teams for Kingstonian Mind United. And so there's obviously a lot of opportunity for synergy, but yeah, we should explore that some more, definitely. Next slide.
And then just to bring in one final point, and then we'll move on for you, John. We've got Angela as well, who's raised her hand from.
Oh, sorry. Yeah, please. Yeah, go on.
Oh,
Angela.
Angela.
Always do it. Hi, it's just on the point of, was it Patrick's presentation then around the barriers for some young carers or all carers in terms of being more active. And I think just thinking about what this is something that a big area of work that we're developing in Liverpool at the moment. And I think I put it in the chat anyway. Just that term being more active is subjective, isn't it? And thinking about that in the context of the barriers for young people, I think as people who have the ability to change practice or provide opportunity, I think it's really important that we are checking in with the carers, the young carer, to see what an activity means for them, before we kind of run along and start thinking about physical activity when a starting point will be maybe just going for a walk or doing something more holistic, and that's absolutely okay. So I just wanted to get that in there really, because I think it'd be helpful for other people who don't work within carer service to think about that in a wider context.
Yes, I agree totally, Angela. And curiously, although I can never quite understand it, there are people who don't actually like football very much. So we need to be very broad in our thinking. So we're now on to carer sports and social prescribing, and we'll return to social prescribing a little bit towards the end when we talk about opportunities. But one of the things that was flagged during the conversations was that there was opportunities for possibly for including young carers in social prescribing activities, and indeed there are things starting to happen about this. We've just picked up via a colleague from what used to be Public Health England, which is now OHID, that there's work going on around social prescribing and young people, and there seems to be some project work that may be happening with the FA and the English Football League, and indeed someone who might be able to tell us more is on the call. So Tracy, if you're still there at the end, I was hoping that I might ask you a question, and as well as people asking the speakers. We've also noted that there are lots of examples of other sports where there was something happening in the initial report, and that's really been developing quite a lot. So if I could have the next slide. So we've been contacted by England Rugby, which is the rebadged name of the English Rugby Union Federation, and they're wanting to do some work with us. We've already had several meetings, including a joint one with Patrick from Carers Active, and England Rugby are interested in planning to promote the idea of involving young carers in programmes aimed at young people, in looking at how they can support their clubs, affiliate clubs, to become young carer-friendly organisations. They can see that some of the community programmes using things like touch rugby for younger children or walking rugby could provide taster sessions to involve young carers, and they're very interested in participating in the Carers Active April. And I think for rugby, but also in general for our networks, that campaign in April could be a really good opportunity to initiate new activities. So we'll be feeding back via the newsletter as we progress in the conversations with England Rugby, but it's really quite exciting to see this move to another sport. I mean, what's become clear is the kind of work we've seen in the football clubs that we reported on is eminently transferable to other sports. And indeed, I actually had a contact a few weeks ago via LinkedIn from someone from the USA who's interested in raising the conversation in relation to American football and baseball Little League. Whether they'll get anywhere and what will come of it, I know not. But I did see a note they'd sent to about 2 million people, so maybe something happened. But it was interesting that they saw the connection anyway. Next slide. Another sport. I hope my colleague who helped me, my son actually, who helped put these slides together for me, is correct that that's a netball ball, but if it's not, Jodie, don't enlighten me. But pretend it is. And one of the a very interesting example came out in one of the discussion we had in the conversation with colleagues from NHS England, was one of in all sorts of walks of life, there are people involved in sports and in their community, and Jodie, as well as being a regional carers lead, is the chair, one understands, of the Hitchin netball club. So I wonder if you could tell us a little bit about what you've been doing in Hitchin on that.
So thanks, John. So I think anything with sport, I think we're all competitive. And when I was hearing about all the good work that was being done in football, I wasn't particularly pleased that we weren't doing anything in netball. So I thought we'd start with our club. And one of the first things that we did was that we looked at our registration process. So we have 140 members, and in September this year, when they all came to rejoin the club, we added a question which says a little blurb saying that we want to support young carers in our netball club. Do you support anybody? We didn't ask the "Are you a young carer?" question. We did put the "Do you support someone?" And I don't know why it was surprising, but we had 14 young carers, or 14 people come back to say that they were young carers. So that was 10% of our club membership. What was interesting was when we did a breakdown of the year groups. So we have players from year 5, so that must make them about 9, up until 18 in our club. The highest number was in the 10, 11-year-olds. So we had 4 in that year group. And we have around about 20 kids per year group. So our biggest numbers were with the youngest kids. We also do a performance program as well, and we have added that question to there. We've got about 25 players that do that, and none of them were young carers, interestingly. So we'll do a little bit more work just to look at that. One of the things that we're doing is we're offering fundraising specifically within the club for young carers, so that we'll be able to pay for membership for those that can't afford it. We're looking to run some programs with, we're going to challenge the local Super League club to see if they can provide some bespoke activities or coaching sessions for young carers, and we'll link in with our local young care organisations as well. So I think we're just quite excited to explore what the possibilities are. With funding, we are funding one of our young carers, so we fund her position in the club and we fund her kit as well. So I think that's it for us.
Yeah, I mean, that's really good, and as I say, it just shows the approach is really not football specific, is it? Could be translated to most sports, really.
And I think it was, oh, sorry, John, I was just going to say, it was really easy just to pick it up and transfer all the work that was being done in football to another sport. The other thing that we've done on our website is that we have now got a young carer page. So on our club information, there is a page specifically about young carers, what that means, and contacts of our local young care organisations as well, that people can look at if they want to.
Yeah, thanks for that, Jodie. I mean, just I mean, it's perhaps not a question, but just a comment before we move on. I mean, although you kind of adapted what's been done elsewhere, actually what's really interesting, you've also added some value here, because it was really interesting, the little survey you did. Okay, Hitchin Netball Club's not a huge organisation, 140 children, certainly worth talking to. But if we could get that idea copied by the clubs, that could be really quite impactful. So it's a really interesting idea, that, I think. So actually Hitchin Netball Club have not only copied but have added to the conversation. So thank you for that. And if we could have the next slide. Oh, and that's just a picture of yeah. And next slide, be welcoming Kelly and Alex from Manchester. I have to say, when we did this trawl, I was actually gobsmacked, if you pardon the vulgar parlance, to find out that one of the clubs doing this was actually the Premiership champions, and also it was some quite phenomenal work happening in Manchester. So if I could hand over to our colleagues from Manchester, and they could perhaps introduce themselves and their slides. So that's next slide, obviously. Kelly and Alex, are you there?
Brilliant. Yeah. Hi, sorry, my computer's going very slow today. Were you there as well, Kelly?
I'm here, yeah.
Fab. So yeah, hi, I'm Alex. I'm Partnerships Officer over at Manchester City in the community.
And I'm Kelly Hockaday. I'm the Young Carers Coordinator at Manchester City Council. Can we have the next slide, please?
Brilliant. I think just to start off, just to give a little bit of an overview about City and the community as a whole. We've been going since 1986. So last year we had a big celebration for our 35th birthday. And we do a lot of work around empowering people to live healthier lives using football as a kind of memento to bring them in. We used healthy futures, healthy communities and healthy lives as our kind of 3 points to really bring everybody in the community together. We work with children as young as 2 all the way up to adults as old as 88. I think our oldest participant is at the minute. So a huge kind of array of different people who we can help out, and young carers definitely come into quite a lot of our different projects. A bit of an overview, just kind of a few that they can come into in a way. So first of all is Kicks, which I think if any of you know any of the football clubs, is a Premier League initiative. So a lot of the clubs who've got kind of charity arms will have Kicks. That works with children ages 8 to 18 and is just essentially a way of them playing football in their local communities. We run it throughout Manchester and Greater Manchester as well. And a lot of young carers will come to that as a pit space to be able to get away from their usual caring responsibilities, meet a lot of other young people, and just have a bit of fun for a few hours after school or on the weekend. We also run Premier League Inspires, which is our high school programme, and again uses the kind of allure of the Premier League and football to bring people in. This is usually with young people who are at risk of being NEET. So usually referred by their school as wanting to take part in this programme, where we do classroom sessions, as well as then taking them out to play a bit of football and sports as well, and giving them a chance to work in smaller groups and also to kind of speak with different people about what's going on in their lives. And again, we can have young carers who are referred into this programme. Lastly, one of the ones I wanted to kind of draw attention to was City Thrive, which is one of our newer programmes and uses different approaches to speak around mental health, especially with kind of younger students. And again, is a really good way of kind of getting people involved in a way that we do meet a lot of young carers that kind of come onto that programme as well. You want to do the next slide for me, please? Kelly, I don't know if you want to intro this one.
So we've done quite a substantial piece of work. It's an ongoing organic piece of work with lots of Manchester young carers, and this is the most recent part of an arm of a campaign that we've got running at the moment called Support Not Sympathy. That's very much around seeing young people as young people first, and that the caring role is just an additional thing that they do. So young carers across the city did a series of open letters to lots of different professionals, and this is their open letter to our youth providers. And if we can press play on that, please.
Dear youth provider, as a young carer, I don't have time to go out and do fun things with my friends. This means I'm missing out on my childhood experiences to go out to youth clubs, outdoor adventure activities such as camping or joining a sports team. My peers have the opportunity to enjoy the activities that other young people will consider as normal. This makes me feel less confident in myself, which sometimes makes me feel isolated. I also struggle to improve my skills such as communication and being able to speak to my peers about my caring role, making me feel worthless. I think that youth centres should think about the time of day when planning the activities and the sessions to be more inclusive. This includes taking the extra steps when planning trips such as residential or organise a respite to allow me to have a short break from home. I would like youth centres to help me to access the many young people that attend there who also have caring responsibilities and also have the resources and connections to give me the support I'm entitled to. I think some practical things is to have a youth worker who's assigned to keep an eye out for me and make the activities more accessible, making sure that I'm not getting bullied. Maybe running awareness sessions could help with this so that others understand. Also, it would help if you could think about how I will get to the youth group, maybe help me with my bus pass or link me up to a group nearer to me. You might know other young people who live near me, and so we can travel together. It is important that I'm not worrying about how I'm going to get there. If possible, set up a group for me to meet with other young people in similar circumstances. I would also like the youth care centre to stay in contact with other services so I can get support elsewhere. I'm not asking you to treat me differently, just to recognise that I'm still a normal young person and would like to fit in with the other young people coming to your centre. Yours sincerely, young carer.
Thanks, Andy. Can we have the next slide, please? Alex, if I can give this one to you. I think we might have lost Alex.
I think
Is she still
Alex's
in on?
connection's just gone because I think we've just lost her from the call.
Okay.
There's neither waiting room to let back her in when she joins.
It's okay. I can set the slide. It's not a problem. So this is essentially how you know, City in the community do have a very much community and youth arm and youth workers working within their provision. And this is how they've responded to the ask of young carers. So they've ensured that every member of staff in their KICS programme are young carer aware. That means they've had sessions of training with myself and they understand the identification. And a real strength of that model is also using session times to be able to promote and raise awareness of who young carers are with their current cohort or new kind of sign-ups. Taking a flexible approach, so it's making sure that they've got an ear during session, they're thinking about the times to get there, and also things that they might be lacking in terms of the material resources like kit and stuff like that. They've done millions of things for us in the community, and just to echo something John said before around not everybody's a football fan, I couldn't be more further away from understanding anything about football and practically having heart attacks on watching games because I don't get what's kind of going on. But actually, if I was to support a club, City would be that. They've just been fantastic. So over the past 3 years, they've donated books and Easter eggs and massive amounts of kit from their youth team, which we have a champions model in Manchester. So that means our schools have young carer champions that we can send that kit to, and it makes sure it gets to the right children. So that means a real stretch and depth of reach. During lockdown, they supported young carers in sessions, but they also did things like run an appeal for tech. And just because of the name, the city and the fans and everything else got behind it, we managed to get 30 grand's worth of tech. So all young carers ended up with laptops and phones that needed it, so they weren't digitally isolated. They do a Christmas appeal, which is very well thought out. So we get toiletries, clothing. We've got a Christmas party again this year. And then in terms of all the kind of things they do anyway for all their people, like the fun runs, you know, transport or absolutely anything, they ensure that that's accessible for young carers. So it's just having that extra sensitivity. It's not sometimes needing that extra you know, that different approach. It's just that looking through a different lens, that there's some additional barriers for this young person. So next slide, please. This is Craig Bell. He's a football partnership manager, and you're just going to hear a few words from him just to kind of round up the ethos of City in the community for young carers. The links in the photo.
Spare me 1 second whilst I'm just loading the video up.
And you can tell they work for a City Club. Let me look at that picture. I don't think our staff pictures look like that. We'll get one take.
So we are City in the community.
Andy, that's going to need skipping on. It's not started at the right time of the video, so it needs to be on 13:03.
I'll start it. I'll see if I can get it through the link again. If not, I'll go to 13:03. There we go.
So we are City in the Community, and we help young carers in a variety of different ways. We're a charitable foundation who works with young people and the rest of the Manchester community and wider Greater Manchester community to try and overcome barriers and help everyone back into some sort of positive lifestyle. Over the years, we've worked with the young carers to become a young carer aware organisation with young carer aware staff. We'll help young carers overcome barriers in attending sessions, to support in school, to make sure that when young people and young carers come to our sessions, we're aware of some of the hurdles and barriers that could hinder them coming to our sessions, like turning up late, maybe not turn up for a few weeks, so we can work with young people and young carers in that way to make it as easy as possible. It's really important for organisations like City in the Community and other, not only charitable organisations and community organisations, but organisations around Manchester and Greater Manchester, to get involved with the Young Carers Network, to make sure that these young people fulfil their potential. You know, they may have other responsibilities at home, and they may have other things on their mind, but that doesn't mean that they're not capable of great things. And if we can nurture that drive in these young people and give them opportunities to go on to higher education, go into job placements and you know, really fulfil the potential, and I think it's our duty to give these young people that opportunity and work with them as much as we can. We'll continue working with the Young Carers Network throughout the coming years as well, because we've made some great links and we've met some really great young people coming to some of our projects, not only the football-based projects, but some educational projects and holiday activation. And we really love the partnership and relationship we've got with the City Council in this area, and we really hope it continues for a long time.
Thanks, Andy.
And just to say, we've also got Alex back as well, Kelly.
Lovely, thanks. So it's the next slide, please. So this is just a few pictorial examples of just some of the support that City in the Community have provided over the last kind of 3 years of our partnership with them. It might look quite you know, a quick win really in terms of the Christmas gifts that they get, we donate them, but it has a massive impact for us because it means that the school champions get recognition and it aids them to be able to support the young carers in their school and their communities. So it incentivizes, not that our schools need it, you know, we've got really proud of the work that's taking place in our schools, but it is just that whole community. It's not just the football, it's that whole city, whole community approach to getting that recognition and support for the young carers. And that has led on to other things. So you can see in the top left hand corner there, we've got early help and social work teams that have received City kit and been able to donate that to the young carers that they're working with, but also be able to help them to link in with you know, any activations and things that are taking place with City in the Community. They'll take them as their key link worker until they've got the confidence to attend on their own. So it's kind of the whole kind of lots of different cogs in a big machine kind of working together with that same aim. And what's really important is that in the KICS and all the other programs is that they're not young carer specific, and we definitely wouldn't want that in Manchester for City in the Community. And we've been offered, you know, we're going to run this, we could run a group just for young carers. That's really limiting, and this is about expanding horizons for young carers, getting them to know that, yeah, you've got some differences and some challenges, but we'll be the ones that bend and make the changes to accommodate some of the challenges you face, rather than doing what's easy, which is sometimes just doing a standalone, because that's easier to coordinate. And this allows for children to spend time and have that opportunity with other young people who might have that same interest in football, or might have you know, a completely different horizon, and that, you know, that's how their own worlds are expanded, and it's more than just a caring role. Next slide, please. Just a little example again. We've got inspired by the England Lioness win, a group of young carers at a primary school wanted to set up a girls' football team. I reached out, City in the Community donated some kits, and they've been won with pride by the new recruits that are now you know, doing fantastically well. And they've expanded the group, so it's not just a young carers girls' football team, it's for all, but it's headed up. And you know, if you think about the teamwork, self-reliance, the kind of skills that our young carers develop as part of their caring role, they've been able to utilize that in terms of setting up a football team. And I think what's just important to touch on here is we know that for most carers, anecdotally, historically that the larger proportion of carers, and particularly young carers, are girls. And when we're thinking about football and these sports that have historically had a very male-dominated kind of, persona, that kind of image that's out there, not really been. I think it's only in very recent years that it's becoming much more, aimed at young girls and women to get that and pique that interest. So we're starting to see those changes, but I think it's something as clubs to consider about how we engage specifically with girls. And specifically young carers who are girls, and some of those additional barriers of perhaps being in a household where sport's not a feature. Interestingly, I was a young carer, was brought up in a household of 3 boys, and not one of them was sporty. So it's one of those things. If you're not introduced at a very early level and there's not those opportunities, you do miss out. Next slide, please. You might know this gentleman and this young lady. They were at a recent football pitch opening in one of our youth centres in Manchester, and lots of our young carers attended that. And again, it's just another example of City and their commitment to the community of Manchester and raising the profile and making sure that there's opportunities for younger, and lots of our disadvantaged communities in Manchester are getting to see that actually these things are in reach and providing that provision. So we know that football can make a huge difference to young carers. I don't need to tell you guys this, it's a teamwork and belonging, the physical activity that reduces stress, about that resilience. But I think the main thing is about aspirations and achievements outside the caring role. So sometimes we've got to be careful that we're not taking kind of a saviour approach by providing opportunities that feel somewhat tokenistic, or got the feel-good factor, but what's the end outcome? What is it we're trying to achieve? So it's about expanding the young carers' opportunities and different backgrounds and all sorts of things, really. And just a bit of a domino effect of things that happen. Can we have the next slide, please, Andy? So by attending this pitch opening that we knew Phil was attending, I didn't know who Phil was. I was the idiot running around with a camera asking my husband, who's this guy here? He's like, he's one of the best football players in the world, through gritted teeth, because he's a United fan. But I met this wonderful young lady called Beth. And we just got talking, and she told me she used to be a young carer for her brother, and actually football for her was a solid element throughout her life during the time period that she was a young carer, and it just gave a focus for her, the exercise element of it, but it really got her into the competitive side of it as well. She's now I don't know whether we call it professional, semi-professional, without being insulting, but I've already kind of said I don't know anything about football. But she's now the goalkeeper for Salford City Football Club. She's got a first-class degree in football coaching and management. She's just phenomenal, really inspiring, and wants to use her own experiences. So one of the first things to highlight to other young carers the benefit, but also to get other activations going, and recognising that the importance. So she's going to go and do some sessions with some of our young carers. Her first stop is the school. We've got the young carers football team. So again, it's just recognising that it's not just big clubs opening doors and saying, we've got a young carers arm. It's about saying we are inclusive to all, and we know that what some of the challenges might be, and showcasing some of the really good examples. And offering opportunities so that kids that weren't previously interested in football, again, City did our young carers Christmas party, and lots of young girls attended that who had no interest in football but are now taking an interest in football. So it's just about, if you're not introduced, if it's not shown, you're not going to know whether you like it or not. And that's it. That's my waffling over. If there's any questions, Alex and I are here to take them.
You there, John? Whilst John until he gets his microphone back on, just want to say, Kelly and Alex, absolutely thank you ever so much, and that's absolutely brilliant. I'm just absolutely, again, similarly through gritted teeth, I'm a Liverpool fan from that perspective, but absolutely blown away just by the work that's been done from that perspective. And I think that key word is that partnership. And I really like what you're saying about actually sometimes it's not about doing the sort of the quick, easy thing about saying, oh yeah, we'll just do a standalone group for young carers. We won't think about our wider inclusivity from that perspective. That helps it move away from being a sort of that sort of tick box sort of risk of it being tokenistic. So yeah, we've done a group for young carers. We've done our bit, rather than saying actually how do we make our wider offer accessible to young carers? How do we remove the barriers? How do we make sure as Alex said about, and in the video about being young care aware for all of their staff as well. So just absolutely brilliant. So thank you. And John's microphone's back on, so I'll hand back over to John.
Yeah, sorry about that. I forgot. I'm good at forgetting about turning mics back on. But there was certainly no waffling going on there, Kelly. That's quite inspirational stuff, actually. And interestingly, we focused on City in the community who doing all sorts of stuff. There is also quite a bit of engagement with the Manchester United Community Foundation and also with Sale Sharks, the Premiership Rugby League side. So there's a huge amount going on in Manchester. I think there's probably two kind of approaches that clubs are taking. There's a bit of both in Manchester, but a lot of what they're doing is actually about engaging and involving young carers in activities that are aimed for young people in the community more general, and that has a lot of advantages in that it means there's a wider range of stuff offered, but it's also helping young carers to be socially included. There are clubs where there are some young carer specific activities. We heard about that with AFC Bournemouth. Also Brentford have young carer specific activities and actually have a part-time young carer support worker employed by the Brentford Community Football Trust. And basically, to my mind, there's room for both approaches, and it's whatever clubs can get going. It also, Manchester City, of course, are a big club, both nationally and internationally, and they're being able to do a huge amount. We're also seeing quite active projects happening attached to some of the smaller clubs as well. So I think it's important to remember that and don't think, oh my gosh, they can do it because they're Manchester. It's something we can all do. So next slide, please. And now we're going to hear from folk from, well, actually it's not folk from, it's from Sarah, because unfortunately Niall is unwell today, but about some of the campaigns and partnership work that have been going on in Sheffield around sports in general. So Sarah, can I hand over to you?
Yeah, hello everyone. Yeah, it's really good to hear all the stuff, and I love that strapline, support not sympathy, because I think that's really, really important. It's about seeing our young people as a whole, and caring is one part of who they are, but that kind of sense of working with them in all aspects. And I think that's why this stuff around sports and access to leisure is really important. In Sheffield, we've had sort of links to our kind of different sports and leisure organisations for a number of years. They included running, the youth team, football teams have run sessions at our residentials or at our AGM, and there's sort of free tickets towards the stadiums. So some of that stuff has been really, really good, and that's great if you're kind of part of our service. But we're also thinking more broadly. It's been raised a bit about barriers. And how do you remove the barriers for young people to access sports and leisure? And we're thinking there's the young people in our services, other young carers in the city as well, that in terms of how can they access leisure and sports within Sheffield. So can you have the next slide, please? So we're going to talk a little bit about the campaign work some of our young carers have done in terms of improving access to leisure opportunities for young carers across the city. It started as a part of a Carers' Rights Day in 2017, when some of our young carers decided they needed to campaign for better access to sports for all young carers. And they met with our local MPs and they asked for their support. There was a number of issues they wanted to campaign on, and that included the right to kind of good physical and mental health. And they joined forces with one of our Sheffield MPs, Louise Haigh, to campaign for free access to leisure centres in Sheffield. And the leisure centres in Sheffield have been run by two companies, Places for People and Sheffield City Trust. I think that's right. In terms of access to sports and leisures, there's some of the kind of football clubs and different like basketball clubs. There's also organisations, a lot of them have contracts now to run some of the leisure centres, and there's two in Sheffield. As well as another part of the campaign work they did with our MPs was campaigning for free transport, but that's another story. But that's quite important. Think of the barriers in terms of being able to get to sports and get to leisures and take up the opportunities. As the report from Carers UK talked about, for all carers, really the access can be reliant on having enough money, as well as being able to do the transport and get the break. So they worked with the MPs as part of this campaign. And in summer 2018, it always takes time, doesn't it? The City Council and the Places for People paid for free leisure cards for our young carers for the summer holidays. This enabled them to access all the council-owned sports venues in the city for activities from swimming to gym classes, ice skating to golf. So really whatever they wanted to take part in. And because the card was for the young people themselves, it meant they could choose to go with their friends or they could go with their family. It didn't have to be part of an organised thing that we'd done, but they could do that with like I say, with their friends, because that's another part of being able to do that stuff and not to feel a barrier is you can't join in with your friends if they're going for a swim because you can't afford it. So that was in the summer, and this was like a fabulous opportunity. Unfortunately, it wasn't something that was going to be funded longer term. So the young carers continued with their campaign by getting young carers listed on the list of people eligible for what we have in Sheffield called a life card, which gives 30% discount on all activities. And the young carers weren't listed as eligible for this card before this campaign, and that they succeeded, and that offer now continues through to today in terms of being able to access the life card. So what worked and what didn't work? What didn't work obviously was we didn't get free ongoing activities for all young carers. And it took a while to get the system in place in terms of the identification for those young people that weren't part of our service. How were they going to show that they were young carers in order to be able to access the life card and the discounted activities? So that took a little bit of a while, and in terms of the leisure centres recognising they could get a letter from a school or a GP, either from social services or from their school, that could recognise that they were a young carer, as well as evidence there might be from ourselves at Sheffield Young Carers. And another thing that was an issue as well is that, as with all of these, with the leisure services stuff, where their contracts and this contracts change hands, people move on. So you develop a really good relationship with the partnership manager, and then they move on. And so then you've got to sort of build that one back up again. But when you get a good one, it's great to work with them. I think that was shown in the Manchester example. So what has worked well is that the campaign did work in terms of raising awareness about the needs of young carers, and that their physical and mental health are important, and that accessing sports can make a difference to them. And so I think a big sort of learn from it was about kind of really, I suppose I'd say, would be ask, involve and campaign, because that's the way in which we can ensure improving access. So the young people had a really good summer of activities, and we can develop some really good partnership working, which continues today. So if you could have the next slide, please. This was a bit that my colleague Niall was going to do. He's one of our young people's project workers, and he did a degree in sports coaching, and he's been involved in community sports and so on. And he leads on our sports partnership work within Sheffield Young Carers. So it's always interesting when we think about the young people, all the skills they have. You realise that some of the staff come in, they've got their whole range of skills as well. And when someone's really interested in something, that's a really good way of developing some of that partnership work. So last year he was involved in working with our adult carer centre in Sheffield to, as part of Carers Week, to work in partnership with Sheffield City Trust, which is the largest provider of sports and leisure activities in our city. And they ran a campaign offering carers in Sheffield a life card loaded with some free access to 8 different activities that they could use over the next few months. So this was a kind of, we've got them listed on this been able to access card now, access the life card. So how can we now make sure more carers have got that life card and are using them? So this was like the follow-on in terms of the partnership working that we've done with the City Trust. And they held an open day actually in Carers Week and ran a whole load of taster sessions. We took a busload of young people down there, and they accessed a whole range of different sports and activities at the centre, Ponds Forge, which is a big centre in the middle of Sheffield. And we worked with the City Trust's Health and Wellbeing Partnership Manager. And after the event, he said, and this is a quote from him, that seeing so many young people with so much going on in their lives and having some space to be just kids and play was really moving. He said, is there anything we could do to help us? We'd be up for giving it a go. So of course, if someone says that to us, what we're going to do? Well, ask. And so Niall followed this up by saying, in a perfect world, this is what we'd like. And so he mentioned things like being able to do our one-to-one work in the venues. So it might be that we could do a venue where they would do a one-to-one when they're doing some swimming or part of playing badminton, or kind of in terms of doing, sometimes doing those practical active one-to-ones, a really good way of the young person actually taking part in physical stuff, but also they can start having a conversation while they're taking part in something practical, whereas if you're sitting face-to-face isn't always comfortable for young people. We've got free sessions for ice skating. We've got Ice Sheffield here, and last year they gave us a whole free session just for our families, with all the young carers. The whole families could go along. And the idea is termly sessions for our groups. So we run 4 different groups per week, and the idea of being able to take those along as the groups to go along to one of the venues and take part in a physical activity was really important. And they asked for like more family sessions as well, because that's one thing our young people are saying is they'd like to do activities with their whole family, like a family swim or ice skating. So that's kind of one of the works that we've done. And there is also ongoing work with a lot of other sports clubs. Sheffield's got 2 football clubs, which you may have heard of. One of our young carers was part of the girls team there. So there is the way in which those as individual young carers are involved. As I think there was really good examples we've heard already in the presentations. And we've got the football clubs will also do things like the free tickets. They've given us signed football. You can do as a raffle. There's lots of ways in which they like to engage, some kind of more active than others, but as Kelly said in the previous ones, like giving the Christmas gifts and so on, it's more than just giving a gift, a simple thing of a ball. It's that recognition and the importance of the name and the importance of raising awareness and when we advertise, when we say about this signed football, it's just people listen, the Sheffield Football Club's done that. So that's important. And we've got links with Sheffield Steelers, which is an ice hockey team, and Sheffield Sharks, which is our baseball team. So those are really important. And just one last thing was, once you've developed these partnerships, I think that shows in Manchester as well, it's not just about sports. So an example Niall wanted to share was around the Health and Wellbeing Partnership Manager has passed on job opportunities to us as well. And Niall was able to support one of our young adult carers to get a summer job working on sports activities for children. And that was really important because for that young person who got the job, it was knowing that they would understand more about his caring responsibilities in terms of being able to sort of do that job, but gave him work experience as well. So that was really great. So I think one of the big things is it's always just worth the ask, isn't it? Link in and ask, and people are really keen to work with us. And I think that's working together that's really important. I think the next slide is just any questions? Yeah, so we can move on back to John. Thank you.
Thanks ever so much. I think John will just be there. He is.
Yeah, next slide, please. Yeah, so we've picked out some opportunities for development that I think probably be fairly obvious from some of the conversations. This is a summary of some of the things we flagged in the initial report that was done in June. We're looking at how to give advice to football organisations and other sports organisations to become young carer friendly. And that can include things like one of the things that I was really impressed with by what City and the community were doing was the degree to which they worked to help their youth team structure to be aware of who young carers are and that there may be young carers in amongst their teams. If a young player suddenly stops being so reliable, it could be because they've just got a new boyfriend or girlfriend, or it could be they become too fond of their PlayStation, but it could actually be an indicator of some disability or illness in the family which could cause that. And so they've actually briefed their coaching staff on how to perhaps some pointers that might indicate there could be caring at home. Really interesting to see that. So young carers need to be embedded in the safeguarding training that all youth football teams have to have. We want to encourage the Football Association and other sporting bodies to take on young carers issues, encouraging action by clubs, and the stuff that is just starting with England Rugby is a really important example of how that could develop. Next slide, please. We know, I mean, Patrick outlined this in general terms for carers, say similar things, issues for young carers struggling to find sufficient time to exercise or participate in organised sporting activities or other social activities for that matter. There seems, and although it seems fairly obvious that the beneficial effect of being able to so do, it would be really useful if some of our academic colleagues could look at how some research could be commissioned and undertaken to help produce increase the evidence base for this. Next slide, please. So the next bullet point is that one again. So it's a good point. So we've said it twice. Want to make sure that the young carers and carers issues are firmly on the agenda of funding organisations like Sports England and the Football Foundation. We noted that certainly in football, and I think in other sports, there are actually funding pots that are rest with particular leagues, and clubs could make partnership bids to get some funding out of their leagues, which would provide a bit of additional resource, but also raise awareness within the league they're in. We've already talked about the potential value of Carers Active, and then returning to social prescribing. If I'm not pushing my luck, I'm just looking. I mean, there's a colleague, Tracy Lyons, who is on the call. Tracy, if it's not an awful cheek, which it probably is, but I'm a pushy so-and-so, would you be willing to just tell us a tiny bit about our colleague Victoria from OHID had picked up that there's some work going on around social prescribing for young people that's just starting with the English Football League and FA, if I've got that right. Are you able to tell us something about that?
I am, John. Yeah, it's not a problem at all. So afternoon, everybody. I'm Tracy Lyons. I work for the National Academy for Social Prescribing, and I'm the national lead for physical activity. Essentially, my work has been really looking at how I'm funded by Sport England, I kind of have a foot in the Sport England camp. I work in the National Academy, but I also reach into NHS England, and we look at how to build bridges between NHS England and health priorities and health needs, and how we then link that into social prescribing and actually out into communities. And a piece of work that I've been working on has been for the last probably about 12 months now. We've started to look at how we work with football and community football trusts, of which there are 120 community football trusts within the English Football League, and then there is the however many teams, I'm not very good at this one, in the Premier League. There's about 20 odd in the Premier League as well. So there's loads across the country. All of them are charitable organisations that sit behind community football clubs that we see on the telly, and they all of them do some amazing work, some of which you've heard today, around working from young people right the way through to older people in their kind of oldest in their 90s. So we have been working with them to look at how we utilise the power of sport and how we start to link with social prescriptions and football. The FA have just come to the table around it as well, so we're working with them as well. So it's quite a large project, John, around kind of football, that it's more than a game, that actually football and the power of sports can actually really reach in and transform and change people's lives. So that's kind of what we're doing. I think from listening today, I've also met with other colleagues around the Active Carers project with Sport England colleagues last week. So, and I think we all agreed that we could potentially start to link some of this work together, which I think is great. There is a real opportunity with football and community football trusts. They have a great reach in communities. And I think it's something that we can start to explore further. There are national leads within the English Football League and within the Premier League that I can obviously link people to, which makes it easier than going to everybody individually. And we're all working collectively on this piece of work, trying to really show the work, the great work, what community football trusts do. There is a lot of work going on around children and young people with social prescribing, particularly around children and young people around mental health, which was picked up earlier today. I've seen some really good work in different clubs. They're doing some very good work around that. So we're starting to try and expose that, understand what's happening, and starting to build better links. So that's kind of what we're doing. We're using football first within social prescribing, but we do see it widening to other sports. We've had interest from cricket, we've had interest from rugby league, so we've had interest in different areas to what we're looking to do. So you're very welcome to have a conversation with anybody off this call, and we can look at how we can potentially link it together. And even if I met you in contact with some of the national leads, I'll be able to link you to some of that work. And Victoria's just written in the chat rightly that also Street Games, which are a really good organisation, are doing a lot around youth social prescribing. So social prescribing, if people are not too sure what that is, social prescribing is NHS England. Well, social prescribing, to be honest, has been going on for years. Many of us have been doing it for years. It's obviously a different prescription than a medication for someone, so it's that social prescription rather than actually giving kind of a whole, medication for somebody. But also NHS England now have actual social prescribing link workers in many areas of the country. They have link workers, and they also have healthy lifestyle coaches that can help and support people with everything from kind of needing help and support around employability, or it could be some people around housing, etc. So there's lots and lots of work that they do, and every area of the country have now got those, and they're growing across the country. So that's kind of the work that social prescribing is. Many have been doing it for a long time. Now Health are really into social prescribing, NHS England, and we really work with them to look at how we build those links and bridges. But that's a little bit, John, around what we do, but there's definitely some opportunities there. I hope that's been useful.
Very much so. Thank you very much. I mean, it's sometimes asked, the audience can bear fruit. It does on Who Wants to Be a Millionaire, and it did today. So thank you for that. Although what we're going with some wisdom, not £1 million. Perhaps we'll get that out of Sports England one day. But thank you for that. I mean, one thing that strikes me is that, I mean, we know from the statistics that it could be about 3 young carers on average in any class. And but if we look at the cohort of children and young people who are likely to be the target of social prescribing, it's a fairly broad range of children who may be seen as vulnerable in some way because of the circumstances in the family. It could be because of disability or because of caring situations. But there's probably half of any class, or maybe 60% of any class, I don't know exactly, who are not ever really likely to want to know about social prescribing. So if there are 3 out of a third of the class, that's actually starting to be quite a lot. And young carers are actually quite a significant proportion of the potential custom base, if you like, of social prescribing for children. So it's not necessarily about having new and separate things for young carers, but rather about how can we make sure that that all the partners involved in this enterprise are aware of young carers, understand their needs, know who, even if it's simply about signposting them to the local young carers service or for young carers needs assessments. How do we do that? So it would be really good if we could fix up an offline meeting, Tracy, about that. And have we got your email address? Because perhaps we could tic-tac about that after the meeting or on another day.
No, that's fine, John. Yes, you've got my email address, and Victoria's got it. So who obviously linked me into this. So Victoria hopefully can pass that along to you. And I think she sent me your email, so we'll be able to do that. I've just also picked up, so it's easier than me typing. A few people are asking in the chat about how they can find out about their social prescribing link workers in their areas. In every area of the country, there are regional leads, so I can get those posted out to people. I can't get them off the top of my head now because I can't get into where I've got to get them,
well,
but
if you
I can help do that.
If you could send them to me when we do the exchange, we could put that in
Yeah,
the.
I'll do that then. That's
we
fine.
could put that in our weekly newsletter, which
Yeah.
goes to several hundred people.
Brilliant. I'll do that, and then anybody on the call that's asking, they can get those, and I can always send it around to you to send around to the people on the call today. Is that okay?
That is absolutely wonderful. Thank you, and pleasure to meet. So we've got about 2 minutes left for any final questions. Up on the screen is my details if you've got any questions. If people want to talk through issues involved in getting work going in their local area, I'm very happy to try and help with that, or to put you in touch with others who are doing work similar. Is there any final questions, or are we done? Right, that sounds like we're at the end, Andy. So
it does indeed. Thanks ever so much, John, and thanks to everyone. It's been such great, not just in terms of the content of the presentations, but also the conversations and the networking in the chat. So just to say, yes, the chat will be shared. It'll only be shared with those who sort of registered for it from that perspective, just so sort of details aren't out all in the ether from that sense as well. So in terms of anyone who's not yet signed up to the Young Carers Alliance, either as an individual member or an organisation, or just for the updates, there's the web link on the slide there. I'll also send it around when I send the link to the slides and the recording and the chat. This is our final webinar of the year, and we'll be announcing the sort of the topics for next year's webinar in the coming month or so. So from me, just a huge thank you as ever for everyone who's joined, and in particular for all the speakers who shared such brilliant work today as well. And hope you enjoy the rest of your day.